So that brings me to the last decade, which would be my conclusion. That has to do with big data and AI, where you don't see yet as much the prohibition reflex. You do, however, and I don't think it's hard for anyone to understand that the effect of big data on the future of health research is going to be enormous. You need large data sets. It allows you to stratify. It allows you to do resource allocation. It allows you to get the right drug to the right patient with the right physician having the right diagnosis, and so on. Now, the Global Alliance for Genomics and Health estimates that by 2030, so let's say 10 years from now, 83 million rare disease genomes will have been sequenced for diagnosis in 10 years. And 248 million genomes will have been sequenced for cancer diagnosis. That is a lot of data. And this whole genome data is only a small tributary feeding into big data with economic data, social data, linkage data to medical records, and so on. So in May 2018 in Montreal, the G7 had a research summit on the digital future. And they emphasized that such innovations in big data should, I quote, respect principles of public good and human welfare. And it said we need a shift in this new digital life, in this new digital world, with new ethical frameworks. I'm not so sure if we need new ethical frameworks, but we might need new interpretations of what transparency means, accountability means, reproducibility means, and so on. And how do we create a human-centric AI? You know, people are sort of afraid of the machine running away beyond and above us. Well, the Global Alliance for Genomics and Health, which is a loosely knit volunteer community around the world of scientists wanting to share data. They want to share data. They want to create the tools to share it, the standards to make it interoperable, and to speed up, if you like, our understanding of health, and create sort of a genome commons. In healthcare, there are very particular concerns about reliability, safety, privacy, security, transparency, accountability, and so on. And I don't think Cambridge Analytica and other scandals have helped. But the biggest deficit we have right now is the one you can see on this slide, is that as of today, if you go to a population genome reference map, 81% of the individuals whose genomes have contributed are Caucasian. So how can you, in a country such as Canada, which has a great number of ethnic communities, have a healthcare system where the data is not representative of a modern heterogeneous population? And so the whole goal of the Global Alliance then is to foster, facilitate, and improve data sharing. So in the medical context, what we do need to do is to think about how will this affect the physician-patient relationship. Is the physician going to be surpassed by machine-readable technologies that on their own will make a diagnosis? How can big data serve as a clinical support tool? Is every algorithm going to become a medical device, and so on, and so on? These are the questions that Health Canada actually and medical societies are looking at. So we need to reimagine the core tenets of professional ethics. Maybe all the tools are there. We just need to have a picture of the whole regulatory system and add to that an additional ingredient that'll sort of wake people up, and that is a human rights approach.